Illicium verum, Illicium annusatum, a source of Tamiflu, ephedrine from ephedra, and this is a lovely one, Nandina domestica, which is full of cyanide, highly poisonous, but nantonine has been extracted from it as an antidote to ecstasy. It goes into the cell receptors for acetylcholine, for adrenaline, epinephrine, and norepinephrine, and blocks the effects of ecstasy, which is a methamphetamine, on those cell endings. And just to finish, Podophyllum peltatum, used as a poison by the native Indians in America and for treating warts, and if still used to make etoposide, a treatment for sarcomas. And Madagascar periwinkle and European yew both work as poisons by interfering with DNA synthesis and cell division. And vincristine, Catharanthus rosea, this plant contains 0.00003 grams % of vincristine, the first effective treatment for childhood leukemia. And when you think that you need to get 2,000 kilograms of plant to produce one course of treatment for one child, you realize how hard the pharmaceutical industry now work on their plants. And I am finishing with time for a cup of tea. Thank you.
Thank you, Henry, for a beautiful presentation. I think after the workshop, the planning workshop we had back in January, somebody accused me of creating somebody accused me of creating a conference that was too consensual. Okay. Actually, it wasn't too consensual at the time, but they didn't have an ear for the issues that were going down at the workshop. Henry is presenting a particular view, and I think some of the issues are very controversial in this room. Let's talk. Any questions? Michael?
Yeah, I'm kicking it off a little bit with what we did yesterday in terms of evidence-based complementary and alternative medicine and these questions. I guess the problem we face is you've shown lots of very well-known and excellent examples of effective and sometimes toxic plants. But how do we take this forward from what I would call the anecdotal evidence to a more systematic understanding of the benefits and risks of, if you want, the whole corpus medicus which we have with these products? Or in other words, we have the criticism that this is all only alternative medicine, excluding things like digitalis, of course. Therefore, there's a lack of evidence. But is this lack of evidence of a lack of efficacy? So how do you take this forward methodologically?
I think I'm working on the basis that the plants weren't put there by the creator as medicines, right? They've evolved separately and they produce some wonderful chemicals which may have some effect on the human body. I think in order for a plant to have a medicinal effect, you have to have a reason why that plant, what the chemical is inside that plant, and to know what that chemical is and how it causes the change in the human body or the disease process which you want treated. You have to know the chain. You then have to have double-blind trials for most things to show that if you give dummy carrot juice to 200 people and real carrot juice and nobody knows, then you could see which person survives from smoking 20 a day for longer. Except for things like vincristine, where if you had childhood leukemia, you had a 100% death rate, and if you took vincristine, you only had a 30% death rate. You didn't need a double-blind trial. You need efficacy studies and you need toxicity studies. So how it works, what it is which works, why it works, double-blind trials, toxicity studies, and then long-term follow-up toxicity studies. So, for example, aspirin, 1920s, long-term follow-up studies on aspirin, Reyes syndrome or Reyes syndrome. If you give it to children who have fevers, they may develop a small percent get neurological disorders.
That would give you evidence for the individual preparations, not for the whole corpus medicus. I guess my question is more, if you look at the totality of this system of thought versus the totality of other ones?
That was a statement. What was the question?
The question is, from the way I understand you, is you're arguing for the classical approach, the biomedical approach,
Yes.
taking it from phytochemical study, in vitro pharmacology, in vivo pharmacology, clinical studies, and then the use. This is one novel extract or one compound. The question is more, do these systems work as such, or do we have to go through the individual clinical studies? Would you argue we have to go through the individual clinical studies for each and every of these plants?
I think the only way forward is the way that allopathic medicines are looked at and examined. You've got to go down that way. And I do not think there is any mileage in doing anything else. I think anything else is, put it the strongest, fraud or wishful thinking.
Practically.
Yes.
Practically, though, that's a tremendously expensive and long-term, time-consuming process.
Yes.
Whilst the rest of us are taking evening primrose because we're self-experimenting.
Yes.
And what is your view about that? I mean,
Well,
essentially we'll take it anyway.
Yes, I think you've then got to do what the Brazilians did with lemongrass, which was taken widely in Brazil, was to what chemicals are in it. Is it safe? And they said they couldn't find any chemicals which did anything. And does long-term use have any ill effects? And the answer is no. And I think you have got to have proper long-term follow-up of people taking evening primrose to see what it does, see what's in it, and so forth.
But it's clearly not poisonous, so there's no point in legislating.
It's not clearly it's not poisonous. That's absolutely not the case.
Okay, but would you legislate?
Yes, I would.
Interesting, okay.
Yep. Sorry.
Who's chairing?
He's chairing, he's the chair.
Sorry, he asked before, he put his hand up first. Yes.
Can I come up with an idea which may bridge between the two views put forward? Within modern medicine, combination therapy has now become a very acceptable form of prescribing, where you prescribe not one drug but several. And there are a number of reasons why you do this. But maybe the plant is offering more than just one substance. There may be one compound in the plant which is the, so to speak, the lead compound, the most effective one, but there may be other things in the plant which affect its efficacy. It's very difficult to investigate this using modern pharmacology, because investigating one compound takes 10 years. If you're trying to make up combinations, it's very difficult. But maybe there is a link between what happens with the herb. It may function at a much lower level of effectiveness than if you isolate one compound and use it alone.
Right. I mean, I can answer that the reason why the government recommends you have 4 vegetables on your plate at any one time is they're all poisonous, and if you take a smaller dose of 4 poisons, it's safer than 1 dose of 1 poison. But the other thing is, of course, I don't agree with you. I think that you can look at plants and you can study what tincture of St. John's wort does with double-blind trials and see whether it works or not. And that's the basis. Sorry.
Yes, but you're working under the assumption that you're always dealing with products that are single herbs. And if you look at, especially coming from China, many of the Asian countries, you're dealing with formulas. You're dealing with a combination of sometimes more than 25 herbs.
Yes.
And then not only how does that plant interact with another plant, but with the combination of possibly 25 other plants within that formula.
I think much of that's just mumbo jumbo, and that just like William Withering discovered that of the 20 ingredients of the herb which cured the patient of dropsy, of their heart failure, only 1 could possibly have worked. It was foxglove, and therefore he experimented with foxglove. So I think many of those things which are additive are there for no purpose whatsoever, and no more than nitrates in Spam. Right? But the answer still lies that these medicines have to have double-blind trials to show they work, and 2 long-term toxicity studies. That's it. Sorry.